Hey guys, so I don't usually get a lot of engagement on my YouTube content, but you know what? I'm going to invite you guys to share your comments, and I promise I will reply to the comments, at least on this video. So I've been going through a transition period in my physical therapy practice. If you guys know my history, I was not a physical therapist when we started the physical therapy practice, Total Therapy Solutions, but this would have been back in 2001 going into 2002. I had hired a physical therapist. We grew the business. We learned a lot of hard lessons. She convinced me to go to school, become a physical therapist. So I was officially licensed as a physical therapist in 2006. At that time, we had 3 locations across Sarasota, Florida, and we were moving to Ohio. So in Ohio, we opened 2 more locations. At our peak, we had 5 clinic locations, all operating under the name Total Therapy Solutions, LLC. So over time, we learned a lot of hard lessons. We were great clinicians in the beginning. Then we learned how to be halfway decent business owners. We started a family. We, raised our children. And now as my kids are getting older, I've got 1 in high school, I've got 2 8th graders, and I've got a 6th grader. My business, like everything else, is starting to transition again. So we went from 5 locations down to 1.5. We went from a clinical team, an administrative team, a marketing team, a finance team to like 5 of us now. And I'm losing 1 because she's going on maternity leave. So like you guys, I am trying to figure out how to do more with less. I am back in the driver's seat. I am the one answering the phone. I am the one admitting new patients, trying to learn how to verify benefits again, trying to do all of the things that need to be done on the administrative side, because I believe there's technology out there today that can help us automate a lot of those jobs. We just don't necessarily know about it. So as an example, I've been sharing videos lately about incoming faxes. If you guys are like me, you receive new referrals through the fax line primarily. Lately, over the last 3 years or so, we've been seeing multi-page faxes coming through, 10, 15, 20 pages, almost complete case histories. And there is a ton of valuable information in those faxes. There's patient demographics, so name, address, phone number, date of birth. There's case history. What was the physician's finding? What is the physical exam? Sometimes there's imaging reports, X-ray, MRI, plus the impression. Sometimes there's operative reports. There's insurance information, primary insurance, secondary insurance, provider numbers, all of these things. All of this gold is coming in through my fax line. And until now, it's been completely inaccessible. Because what I used to do was pay somebody to take the fax off the fax line, usually paper, sometimes digital back in the day. I guess that's reversed. Back in the day, paper, now digital. They would take that information and they would literally retype all of that information into my software. There's opportunities for error. Sometimes they're typing from a paper to the computer. Sometimes they're trying to look at a PDF on one side of the monitor and then the EMR on the other side of the monitor. It's miserable. So now we know there's OCR, Optical Character Recognition software, that will capture images, turn that image into text, then turn that text into useful information for your EMR. Now, to my knowledge, none of the EMRs right now in the physical therapy, occupational therapy space have that functionality. To my knowledge, none of them will take an incoming fax, take the digital image, convert it to text, convert that text into a new patient admission in the software. I definitely know none of the platforms right now will then also layer on top of that an AI component that will process all of that information and start to generate clinical documentation so that either it will better educate the physical therapist before the evaluation so that I have a chance to read a summary of what to expect when this new patient is coming in the door because it's based on what the physician sent me, or even better, having that information turned into a framework for your clinical documentation for your evaluation. Now, it's still my evaluation, but it's bringing richness and context to the evaluation information. I already use HIPAA Scribe to do ambient listening and physical therapy transcription. I already use Patient Studio for my EMR. I'm rolling this technology in. I've got Sarah Health for a text-based RTM system to stay in touch with and monitor the progress of my patients when they're not in my clinic. But I want to tie this stuff together a little bit better. So my question to you, the reason why I'm recording this video right now is, have you found ways to reduce the dependence on humans in the new patient admission process? I know EMRs, my EMR will allow me to send a questionnaire, and once my patient completes that questionnaire, that information comes into my EMR system in various ways. But what I'm looking for is, even before that, when I hit that first point of contact, for me right now today, 2024, most of the first points of contact are either the telephone call or the physician faxing over the referral information. And a lot more, it is the latter, the physician sending the referral information and asking me to call the patient. In that situation, that is the first point of contact. I want a system that can process the fax document, pre-populate all of the information from the fax into my EMR, generate a basic case summary so that when I am calling the patient for the first time, or potentially even sending that patient a text message or an email invite with appropriate releases and opt-ins, that I would then be able to have all of that information, the richness of the case history ready for me so that I can talk to that individual having that information available. That's what I want. And I don't want a human to have to type it in. I want technology that can do that for me. I know it exists outside of healthcare. I know there are HIPAA concerns and privacy rules in place that limit my access to the best possible technology. Like literally today, I could take an image from a fax, put it into ChatGPT 4.0, and it will read using its own GPT vision. It'll read all that information and turn it into text that I could use right now. But I can't because it's not HIPAA compliant. Regular ChatGPT 4 is not HIPAA compliant. So that door is closed to me. What are you guys doing? I'd love to hear from you. What systems are you using? What maybe hacks or shortcuts have you figured out that are within HIPAA privacy rules and compliance, but that really have had a major impact on your business? And let's keep the conversation going. I'll record more videos as I figure this stuff out.